Hello, Kevin. My name is Danielle, and I'm going to be your nurse today. I will be taking care of you, and we're going to just perform an assessment on the eyes, ears, nose, mouth, and throat today. I'm going to first provide some privacy by closing the curtain, and I'm just going to ask you your name and date of birth.
Kevin Emmert, 7/9/1993.
I'm going to perform some hand hygiene right now, and I'm going to assemble and clean my equipment. We're gonna start off, I'm gonna ask you 2 questions. Any vision problems?
No.
Any eye pain?
No.
Have you been experiencing any drainage from either eye?
No.
Any hearing loss?
No.
Have you had any sore throat?
No.
Any mouth pain?
No.
Any vertigo?
No.
Okay. So I'm going to start by checking your eyes, and we're going to view one of the eye charts, which is called a Snell chart. And I'll just have you read the lowest line on the chart that you're able to see clearly. So if you want to turn for me and cover one of your eyes and read the last line that you can see.
A, J, G, Q, C, U.
And I'll have you cover the other eye and read the last line that you're able to read.
G, H, I, C, J, P.
Okay. And then I'll have you turn back around and look at me. I'm going to hold some fingers out to the side and see if you're able to see the numbers and say them back to me.
3.
Okay.
4.
Perfect. I'm going to just look at the alignment now of your eyes. I'm going to use a pen light. Okay, the alignment is good. Then I'm going to have you just stare at my nose and cover one of your eyes while staring. Perfect. Now cover the other eye, looking at the same spot. Perfect. I'm going to have you just follow my pen light. I'm just going to bring it into, from my distance into your distance, and you can just keep looking at my pen light, but do not move your head. Okay, and back out. Perfect. Next, I'm just going to check that everything looks symmetrical, just starting out with the general appearance of your face, which appears to be symmetrical, the eyebrows, eyelids, and eyelashes, and also the conjunctivi and sclera are aligned, and the lacrimal apparatus is also aligned. We are also going to inspect the interior of the eyeball. Okay. And next would be the cornea and lens. Also going to check the iris and pupil for size, shape, and equality. And I'm also going to shine my light again into your eyes and just make sure that the pupils are dilating to the light. Okay. Okay. Next, we're going to inspect the ocular fundus and just look at the color and integrity. Moving on from the eyes, we're going to now look at your ears. So we're going to inspect the external part of your ear. I'm just going to look at the size and shape of your ear and the position and alignment of each ear. Okay. There doesn't appear to be any type of skin conditions Color is fine, no lumps or lesions. We're going to palpate the outer ear, and I'm also going to do the tragus and the mastoid process, which is behind the ear, for any movement or tenderness. Is there any tenderness?
No.
Any tenderness?
No.
And I'm going to do this to the same side. Any tenderness?
No.
Any tenderness?
No.
Okay. And then we're going to look, I'm just going to look inside your ears for any type of discharge or redness. Okay. And when we're doing the inspection of the inside of the ear, the tympanic membrane, as far as color, it was pearly gray, and the light does reflex off the membrane, and there was no scars or any lesions inside of the ear. We're also going to do a whisper test, which I'm going to stand behind you, have you cover one of the ears, and you can just repeat back the word that you hear to me. Okay, I'm going to stand behind you.
What?
Okay, have you cover the other ear. And just repeat back to me what you hear.
What?
Okay, perfect. And now we're just going to use, I'm going to perform a rind test, and I'm going to have one of the tuning forks at the base of your ear, and you're just going to tell me when you're able to hear the sound as I'm moving the fork from the front of your ear. So, okay.
Yep. Yep.
Next, we're going to check the nose. I'm just gonna look at the outer part of your nose, and there are no lesions, no discoloration. Next, I'm going to have you plug one of your nostrils and sniff in, and then do the other one. And I'm just gonna have you sniff one of these jars to see if you're able to smell what's inside.
Mint.
I'm gonna inspect just the inside of your nose. I'm just looking for any discoloration to the inside of the nose, if there's any bleeding, any swelling or polyps. I'm gonna inspect it with my pen light. So I'm just gonna have your nose up and look, okay. Okay. I'm just gonna feel your sinuses right now, and you just let me know if there's any tenderness as I push.
No.
Any tenderness?
No.
Next, we're gonna move on to the mouth and throat. So I'm just gonna look at your lips, your teeth, your gums, and your tongue. And again, look for any discoloration or lesions. So are you able just to open your mouth for me? Okay. And I'll have you say ah again, so I'm able to look at your vulva. Okay. We are now going to assess the glosopharyngeal nerve to make sure that there is a gag reflex. We're going to assess the vagus nerve, which we did by having you say ah, and we inspected the vulva and the tonsillar pillars, and the vulva did move during that inspection. The hypoglossal nerve, we're testing for any deviation of the tongue. which would be in the middle of your tongue. If you're able to stick your tongue out for me straight, perfect. Next, I'm just gonna look at the back of your throat. I'm just gonna look at your tonsils to make sure, one, that they're visible and that they're not touching. Okay, so tonsils are visible and not touching. We're going to inspect the pharyngeal wall for any color discoloration, any type of lesions, and I'm just gonna palpate under the tongue for any lesions, as well as the mouth for any lesions. So I'm palpating the tongue and the inner sides of the mouth. Nothing abnormal. Okay, so it looks like we're all done here with our assessment. There was nothing abnormal that I had found. The mouth and throat, no abnormalities as far as the ears and vision. With the Snell test, you were able to repeat back the lowest line of vision that you could see. With the ears, you were able to repeat back from the whisper test. So is there anything else that you need from me today, or any questions that you have?
No.
Okay, looks like we're done.